Scientists at the Kenya Medical Research Institute, KEMRI, are tonight warning that the country is not out of the woods just yet, despite dodging the fourth wave of COVID-19. KEMRI had predicted that the month of July would see an increase in COVID-19 cases, but the scientists say this was averted owing to containment measures such as the partial lockdown in the western region. And as our very own Dorcas Wangira reports, the scientists are warning that there is a likelihood of increased infections and hospitalizations owing to political campaigns and major sporting events to be held this month. Take a listen.
KEMRI's prediction of a fourth wave in the month of July, with a peak of infections mid-month, was a dull picture of what lay ahead before the beginning of the month. The modelling had also anticipated an additional 4,300 hospital admissions and 580 deaths, largely owing to the Delta variant. The Kenya Medical Research Institute, KEMRI's acting Director General, Professor Sam Kariuki, explains what informed the projection.
Using a specific mathematical model or a formula that has been derived mainly from previous observations, then you try to predict what will happen in the near future. So you're looking at the various cycles of new infections.
According to the modelling, the start of a fourth wave was imminent in the coastal region and Nairobi County, owing to the Delta variant that was already causing a surge of cases in the Nyanza and Western region. The modelling predicted that the Nyanza and Western region's health facilities ran the risk of being stretched beyond their capacities.
That hasn't happened, and we should all be glad that that really hasn't come through. However, prediction models also do something else. They tell us that unless we are able to intervene, this will happen. So it's like a warning sign.
However, according to health experts, the government's intensified surveillance in the 13 hotspots in the Lake Basin, continued measures such as mask use, social distancing and hand washing also helped avert a fourth wave. Increased vaccination was also a critical intervention.
We believe certain measures that we took early in the month of June could preempt the development of a fourth wave coming in July.
In the month of July, so far by Wednesday, 21st July, 10,149 positive cases have been recorded. 111 deaths have been recorded. But with late deaths being reported, it may not give an accurate picture of all the deaths that have occurred specifically in the month of July. 257,890 doses of COVID-19 vaccines were administered, with the population of adults fully vaccinated marginally increasing. Nairobi has continued to record the highest number of cases consistently, which was accurately predicted. In the last 24 hours, 503 more people have tested positive for COVID-19. Out of 4,060 samples, the test positivity rate is 12.4%. 11 deaths have been recorded, bringing the fatalities to 3,811. 1,253 people are admitted in various health facilities. Nairobi has recorded 334 cases, the highest number in the sample size. Kilifi 84, Nakuru 21, and Kiambu 20. The adult population fully vaccinated is 2.2%. However, with increased political activity around the country, the just concluded by-elections in Kiambaa and Muguga, entertainment events, sporting events, including the just concluded World Rally Championship in Naivasha, KEMRI scientists warn that there is the likelihood of increased infections.
The virus will still be around for a long time to come because we still have people who are vulnerable, people who are incubating the virus and who are non-symptomatic and who can still be able to pass it on to vulnerable populations. We really must observe all protocols, and when available, vaccines should be deployed.
Kenya may not have experienced a fourth wave as predicted by KEMRI, with a peak in mid-July. However, COVID-19 still remains a present reality, and Kenyans cannot afford to relax. Dorcas Wangira, Citizen TV, at the KEMRI Institute, Nairobi.